Speaking of going back to work, that can lead to big problems for dogs. A lot of us got four-legged friends while we were working from home. But now shelters are seeing the opposite. Lots of people are returning them.
Team 12's Nyala Charles takes us into the shelter's dilemma.
Maricopa County Animal Care and Control is at full capacity. In the last 6 weeks, they've had a huge amount of dog returns. The thought of that is unimaginable for Debbie, who just found her perfect match.
I decided on naming him Uno because he was the one.
This wasn't a spur-of-the-moment decision for her. She's been mourning the loss of her last dog.
But I waited like a whole year, so I'm like totally ready.
Okay. Unfortunately, that's not the case for everyone.
It's a real increase in owner surrenders.
So much so that the center is booked until June for animal returns. That's a 180 from a peak in adoptions at the beginning of the year.
People wanting to adopt, they were at home and wanted to spend more time at home with their pet.
But with more people getting out there, behaviors are changing.
People have less time, they don't have the space of time, or they're not as home as much.
There are steps you can take to ease your dog's separation anxiety. First, the American Kennel Club says ease back into old routines by getting up at the same time and leave your house for periods of time before you have to return to work. Second, social distance from your dog by keeping them in another room or in their crate while you do other things. And third, interactive toys can keep them from getting bored and help distract them while you're gone. For those of you thinking now is the time to get a dog.
A dog is a lifetime situation, so you can't rush into it.
There's a dog here looking for a forever family.
Excited to go home now and give him a new home.
She's crying real tears. I know she is. It's all right, Bree.
Well, this is Bree. She is a 9-year-old mixed breed that was originally rescued here back in 2013 when she was abandoned in a garage with her puppies. We rescued her back then, adopted all of her puppies out, and treated her for heartworms, had her spayed, and found her a home. She was returned a few years later. They said they were having a baby and didn't have room in their lives for Bree, so we readopted her to a single gentleman who came in and adopted her right after that. She was returned again today. His reasoning was that he was married now and didn't have time for her. Bree is now 9 years old, which is going to make it very difficult for her to find a forever home. We have had a big response, but we've got to find the right fit for her because we don't want this to happen to her again.
She's got real tears running down her face. I'm just wondering. A return, actually.
Bree, honey.
Tony, hey.
Undeterred by public health measures banning indoor church services, these parishioners gathered this morning as their pastor spoke against COVID restrictions.
Never thought we would come to times like these in Canada.
Some here still believe COVID is a hoax, even after getting it.
There have been a few patients that, even at death's door and on their deathbeds, are in denial.
Dr. Ganesan Abu works at the City of Winkler's Hospital. The facility has had so many COVID patients on ventilators, it's experienced a shortage of oxygen.
There's this idea that we are somehow colluding with a conspiracy that this virus is not real.
The makeup of the community is one that is self-reliant and believe that the less involvement you have with the government, the better off you are.
Manitoba's vaccination rate is almost 65%, but just a quarter of people in Winkler have had a shot. It's even lower in the rural municipality of Stanley at 13%. As the ICU crisis escalates, military lab techs have started their deployment. Ambulance services and the armed forces are continuing to fly critically ill patients out of the province. This doctor is one of a few who called on the government to bring in a stay-at-home order this week. She's critical of how things got to this point.
With the kind of second wave that we had and this delayed onset, as you point out, of the third wave, how could we have delayed action?
Manitoba has ramped up its weekday vaccination significantly. But now another hurdle. The province won't meet its target of getting first doses into at least 70% of the population by June 9th. Officials say the reason, another shortage of Moderna doses combined with decreased demand.
Let's talk now about breakthrough COVID cases. That's when people contract the virus after vaccination. They are extremely rare, but in Napa County, what appears to be the Bay Area's first fatal breakthrough COVID-19 infection has happened. The victim was more than 65 years old with underlying health issues and a resident of a long-term care facility. Public health officials say her death underscores the importance of getting more people vaccinated.
So far,
Napa County Public Health Officer Dr. Karen Relucio says the COVID-19 victim was fully vaccinated.
this person lived in a congregate facility and was exposed to a staff person who was unvaccinated.
Her death is tragic, but these cases are extremely rare. In Napa County, more than 71,000 people are fully vaccinated. They've reported 32 breakthrough cases, which is an infection rate of less than 1%. Nationally, it's even less. The woman died after being infected with the B.1.1.7 variant, which is the one that originated in the UK. It's highly transmissible and can make people very sick. She was in a hospital for about 2 weeks. Public health experts say her death is an example of why they're pushing for more people to get vaccinated.
Well, senior citizens and those with weaker immune systems from underlying medical problems may not develop as strong an immune response to a vaccine.
The case also raises an important question about employers mandating employees to get vaccinated. Workers in assisted living facilities were among the first who could get their shots in California.
According to employment law, employers can mandate vaccination of their employees.
Now, it was meant to be the day England unlocked after months of restrictions, but now the Health Secretary, Matt Hancock, has confirmed that ministers are considering leaving coronavirus restrictions in place beyond June the 21st, amid concern over the spread of the Delta variant, which was first identified in India. He revealed that scientific advisors have told the government that the Delta variant is 40% more transmissible than the Alpha variant first detected in Kent.
The Delta variant, first identified in India, the UK's latest epidemiological curveball. Responsible for a large spike in COVID cases, but so far doesn't mean more hospitalisations. Thanks in part to the effectiveness of the vaccination programme. The Health Secretary today, though, said it was much more transmissible than previous variants.
Well, the best estimate of the growth advantage, as we call it, of the Delta variant from SAGE is around 40%. So 40%. That does make life more challenging for everybody. And you've seen that the case rates have risen a little. But the good news is that the hospitalizations, the number of people arriving at hospital is broadly flat.
The Delta or Indian variant is scrawling a big question mark over the possibility of restrictions easing come the 21st of June. Matt Hancock went on to say that the government is open to delaying what's become known as Freedom Day. There are reports today that the new date could be pushed forward by a fortnight to the 5th of July.
Canada's rate of vaccination is right now among the world's fastest. We recently passed the United States in first dose vaccinations, and as of today, we're also ahead of the UK. But the picture is stark when compared to the developing world. The light blue portions of this map show the countries that are the least vaccinated. Just look at the entire African continent. And 1.3 billion people, only 31 million have received one dose. That's slightly more than 2% of the population. In the last couple of weeks, cases of COVID have begun to surge throughout Africa. Maria Van Kerkhove is the COVID-19 technical lead for the World Health Organization, and she is in Geneva. Maria Van Kerkhove, thank you very much for joining the program. It's a pleasure to have you here.
Thanks so much for having me.
I want to get your sense of where we are in the pandemic right now, and in part because I'm talking to you from Canada, where we are talking about our reopening plans. We look south of the border at our big neighbor of the U.S., and they are already reopening. But is there a concern that when we look at our own horizons, we're forgetting about what is happening elsewhere in the world?
Well, yes. I mean, we live in a globally interconnected world, and this pandemic is far from over in most parts of the world. Globally, if you look at the global level, we've seen a reduction in cases and deaths in the last 4 or 5 weeks, and that is really a good sign. However, if you look at each of the regions around the world, and at the national level and subnational level, the intensity of spread is really drastically different around the world. We have hotspots or areas of concern in all regions of the world, even in the Americas. South America right now, many countries are facing incredibly challenging situations. Countries in Europe and in the eastern part of Europe, countries in the Middle East, even countries in Southeast Asia are seeing some increases in cases. So we all continue to be at risk. And there's a number of reasons why we're seeing these challenges, seeing these increases in cases. And it's a combination of factors that are really leading to all of that.
Vietnam is banning incoming international flights from today for a week as it battles a surge in coronavirus cases related to a new variant. The government says the highly transmissible variant is a combination of those first discovered in the UK and India. NBC News foreign correspondent Janice Mackey-Frayer joins us from Beijing with more on this. Janice, good morning. So up till now, Vietnam had actually avoided major outbreaks. So how worried are officials about the spike in cases and what's being done to stop the spread of this new variant?
Savannah, they're very worried about containing this outbreak. The variant is this hybrid of 2 other variants, making it very contagious. It spreads quickly through the air. Health officials there calling it very dangerous. They're getting help from the WHO with monitoring. In the meantime, they're doing mass testing in big cities. There are curfews, restrictions. Businesses are closing down, effectively seeing the first lockdown. What they're also trying to do is ramp up vaccinations. The problem with that, like in a lot of places in Asia, is supply. They just don't have enough. They're in negotiations with Moderna. They have some Pfizer vaccine. They don't want to take vaccines from China. So it means that only 1 million people out of a population of 96 million has been vaccinated so far. So that's what worries officials most as these variants continue to outpace vaccinations.
Vaxxed and waxed, and reporting from Malibu, here's CNBC's Jane Wells.
It's been a long year. Time to put away the sweatpants. Start working out. Lose that mask. Find some lipstick and hit the beach. America is vaxxed and waxed. Hot girl summer is now shot girl summer. And vaccinated Americans are trying to lose the COVID-15 they gained during COVID-19.
I mean, you know, it's like get your best beach body on right now because, you know, starting in 3 days, it's summer.
Right. Nothing says beach body more than outdoor salsa lessons in Malibu, taught by Gleb from Dancing with the Stars. And classes are full here at Rafi Lounge.
How much is business up in May versus April?
100%. I don't want to say it's a blessing because it took a toll on a lot of people and a lot of businesses. But people start to really pay attention to their health. And that's an amazing thing.
Well, I think when you go through a period of darkness, you learn a lot about yourself. It just brings you into such a deep state of gratitude.
3, 2, and 1. Classes are also full and indoors again at the Studio MDR, a boutique gym which barely hung on during the pandemic.
I mean, business dropped by 90%. It was insane. People are coming back and they're excited. People want to be with people.
That's true for 36-year-old Emily Bernath, planning her first trip in over a year. She's bought a cap that says vaccinated to wear when she goes out mask-free, and she's learning to dress again.
I've noticed that I've had to take some photos of myself before I leave the house to see what even looks right, because I just don't know how to dress. Yeah, trying to figure that out.
The COVID-19 pandemic has disrupted countries and economies around the world. People have lost jobs. Poverty is up. Now, an internal government report warns that it's likely to increase the number of people who will try to come to Canada any way they can. In a strategic intelligence report, the Canada Border Service Agency warns that immigration fraud and human smuggling may rise as desperate people in countries hard hit by the pandemic try to get into this country. The agency warns that fraud could take many forms. Fake documents to try to get work or study permits, counterfeit travel papers to try to be able to get on a plane, marriages of convenience, unscrupulous immigration consultants, people pretending to be refugees. Richard Curlin is a Vancouver immigration lawyer. He says lately it's been taking longer for people to get permits to work or study in Canada.
There's increased vigilance, and that explains why in many key visa processing centers around the world, more scrutiny is given to applications to come to Canada, which takes more time to process.
Janet Dench is Executive Director of the Canadian Council for Refugees. She would rather see the government do what it can to help people hard hit by the pandemic in other countries.
They're pointing out how much the pandemic has made the situation of people much worse in so many parts of the world. And it is really pretty crushing to see that the response to that is simply to think about ways to enforce the law against the people who are so affected.
The CBSA says that the restrictions that we've been seeing on travel to Canada means that it has not yet seen an increase in immigration fraud.
5月21日至6月5日24时，本轮疫情全市累计报告94例感染者，包括80例确诊病例和14例无症状感染者。昨天新增的9例感染者，有6例是分布在南沙区的珠江街。广大市民群众非必要不离穗、不出省，确需离穗出省的，需持有48小时内核酸检测阴性证明。
1 year after contracting COVID-19, Andrea Cerisa was faced with something she never imagined: prolonged symptoms and a stack of medical bills.
I've seen so many specialists. I've seen multiple of each of those specialists. A lot of them are out of pocket, a lot of them are out of state. I don't have coverage for out of state.
Her COVID long hauler symptoms run the gamut: gastrointestinal problems, brain fog, dizziness, and severe exhaustion, just to name a few.
I knew that that was my only hope to get help. I had to make the decision to either live or die. I had to make that decision, and so it really wasn't a choice for me.
Afterwards, she says she was billed around $123,000 and showed us her explanation of benefits. She told us much of the last few months has been spent on the phone, trying to see if her insurance could make an exception and help cover the cost.
Now it's, okay, what am I going to do about all these bills? And I do. I wake up in the middle of the night and I'm scared.
It's a post-COVID life she never envisioned. Amy Watson has struggled with similar symptoms for over a year after contracting COVID in March 2020, and she's created one of the largest Facebook groups acting as a support network for other long haulers, hearing stories of many struggling to pay off COVID-19 medical costs.
The vast majority of us have not been able to work or have had to have reduced workloads or working from home, trying to recover and stay afloat at the same time.
Hannah Lockman is one of them. She's been to the ER a staggering 18 times after struggling with painful post-COVID symptoms, last year owing thousands even with insurance.
If I try to think about how much it is
I'm not going to be able to handle it.
What's more, she and her husband had to survive on her income alone for a few months after his restaurant job was cut due to the pandemic. 2020 saw a spike, likely caused by the compounding health and economic crises. Credit Karma reported that medical debt among its members increased by $2.8 billion from the end of May 2020 to the end of March of this year. Another survey by the finance company Access One found that 37% of respondents were concerned they would be unable to pay for medical care in 2021. And while coronavirus testing and vaccines have been made available for free, COVID treatment is much more complicated. At the beginning of the pandemic, some health insurers voluntarily waived costs related to COVID-19 treatment. Since then, though, they've quietly let those waivers expire.
This has been a 2021 Wolfie production. This has been a Wolfie Terrier production 2021. Poor mate had dental surgery yesterday, so he's a little bit tired.